Hi, I'm Tracy. I'm back with my buddy Lloyd here, and we're going to try to give you some tips and tricks for ostomy that hopefully will make your life a little bit easier, maybe something that you can learn from and maybe play off of a little bit. As always, follow your healthcare provider's instructions, especially your wound and ostomy nurse, because they're the best. But here's some things that I've learned along the way from having an ostomy for 12 years, working with patients for over 30 years, and just trying to learn as much as I can. And wound and ostomy nurses have always been amazing to me. I love them. They'll tell you I love them. So Lloyd and I are back. He has a new pouching system that we just put on. It's got some paste, it's got a barrier ring, we put some crescent strips around it, and it's a two-piece system. So Lloyd is really worried about odor. Now, when he's standing here with his pouch on and he's got stool coming out, of course, you know, where all of us are like, ooh, it's poo. You can't smell it. We may think we can, but we can't. But when you dump it, you can smell it. So there are items on the market that are amazing, and some are better than others, and some do a better job than others. So right now we're going to say Lloyd has an ileostomy. He has very liquid stool, and it's not thick at all. It's just very liquidy, like diarrhea. So what do we have for Lloyd? So first off, we have an odor eliminator. Put a couple of drops inside the pouch. And so there's a couple things you can do. You can pull the pouch off and put it in here. So let's just put a couple in here for demonstration purposes. And you can see this is nice and thick, so it's gonna hold up. And then what I'd like to do is let it kind of move down into the pouch. And it's gonna go down there anyway, no matter what you do. But if you squish it around a little bit, it doesn't have to coat the whole bag because it's got an odor eliminator in there. So it doesn't cover it up, it doesn't have floral scent. There's actually no scent to this at all, which is exactly what you want. And it will eliminate the odor. And then when you dump your bag, it will lessen or eliminate the odor 100%. Another item that is great for ileostomates is a product that is amazing, and I can't imagine I lived without this for very long. I also have an ileostomy, lots of liquid. This is called Secure, and these little crystals that come in a little pouch. You just open up the pouch. I'm trying not to get them everywhere. Okay, so you open up the pouch. I'm using handy dandy scissors. Okay, and then you pour the whole thing into the pouch. So what this does, this is pretty amazing, is it gels the moisture. It captures the moisture, the liquid, and creates a gel. So if you have an ileostomy and you walk around and you can hear it slashing, which I can relate to that, this will stop that from happening. It also makes your draining a little bit easier because it comes out easier. This is much easier in practice than in demonstration, but you get the idea. You've got the odor eliminator at the top, and then you have the Secure at the bottom, so you're gonna eliminate odor and you're gonna help keep it from slashing around when you're walking around, but making it easier to drain as well. So now you're saying, Tracy, I have a one-piece pouching system. This isn't gonna work for me. What do I do? Easy. Here's a one piece. Let's pretend it's on my body. So when you go to drain it, you drain it like you normally would, clean it out a little bit so there's no gook on it. And then when you do that, if you have an ileostomy, you can use either of these products. They are somewhat interchangeable, but there is a difference. There's a lubricating deodorant and there's a non-lubricating. Lubricating is perfect for colostomies. Colostomies have more of a thick, normal stool, and it gets stuck, quote unquote, or it sticks to the sides of the pouch. So that's where the lubricating comes in. That thick, viscous liquid that you've seen with that other one is still true here, but it also has a lubricating additive in it. So I'm going to just put a little bit in here. this being thick is just amazing. So you can see it will eventually just migrate around anyway, but I'm not sure if you can see that, but it coats the inside, so when the stool goes in there, it just slides right out. And it also creates an odor eliminating function, not a cover up, an eliminating function. And then the other thing, you could actually add the Ilio-Secure as well. Not 100% necessary, but you do still have some liquid that comes out, so this would just be a little added extra benefit. I would use this both ways, just the more normal I can be, better, but nobody needs to know that I've got this bag and something's slashing around. So that's what I would do. So again, there's 2 types of deodorants on the market. Perfect Choice has both, and they're nice and thick, which is great for doing its purpose. So you have the regular, which can be used for either colostomy or an ileostomy, and then you have the one that has the lubrication in it. This one can be used interchangeably as well, but this one is the best for a colostomy because it helps keep everything moving through your pouch, so it's nice and easy to drain. And then, of course, the most important thing is it helps to eliminate the odor. Of course, the Ilio-Secure, then it helps retain all the moisture so you don't have that slashing sound, and it helps with eliminating some of those leak areas. So this is a great trifecta when you're working with your ostomy. Hope that helps.